Hello everyone, I'm myself Dr. Dipti Kariya and I'm your faculty for physiology. Today we'll discuss about the topic blood transfusion. Before starting my class, I would like to inform you all that you will get all my lecture notes in soft copy as well as hard copy. To get the soft copy, you have to download the application Vesalius from the Play Store and you have to get the subscription. And for hard copy, you can order my book that is Physiology Notes available on Flipkart as well as Amazon. Link for the Flipkart, Amazon as well as my application that is given in the description box. As well as you can join us in our WhatsApp group. The number is 78638 22668. Link for the WhatsApp group joining that is also given in the description box. Now let us start with the topic blood transfusion. Okay. Now what are the indications for blood transfusion? In which conditions we require blood transfusion? First and foremost, that when there is blood loss, either acute or chronic. Acute blood loss, most common causes for the acute blood loss, they are accidents. If there is any accident and the person lost large amount of blood, or surgery, or hemorrhage. Common cause of hemorrhage, that is postpartum hemorrhage after delivery of baby, that is PPH, postpartum hemorrhage. That is one of the important cause for the blood loss, acute blood loss. So in these conditions we require blood transfusion in acute condition. Chronic blood loss like anemia, commonest one, that is thalassemia. Here the patient requires blood transfusion at the interval of every 15 to 20 days or 1 month. Okay. Blood disorders like hemophilia, when there is deficiency of anti-hemophilic factor, hemophilia, then purpura, that is deficiency of platelet, that also requires blood transfusion. When there is blood diseases like different types of anemia, if the person is having leukemia, and in case of burns also, sometimes, most of the time in burns, we give fluid transfusion. Okay. Now what are the precautions to be taken before blood transfusion? One, that is criteria for the donor, which criteria they should be fulfilled by the donor before blood transfusion. One, first and foremost, that is age of the donor must be between 18 years to 60 years, not less than 18 years, not more than 60 years. Healthy individuals are required. They don't have sexually transmitted diseases like HIV, hepatitis. Okay, they don't have any viral diseases like hepatitis, HIV, protozoal diseases, malaria also is contraindicated for blood transfusion. Hemoglobin concentration of the individual, the person is going for the transfusion, that must be minimum 12 gram per deciliter. Okay, otherwise what happens is his or her own hemoglobin falls down. Okay, pregnant and lactating mothers are not advised to transfuse the blood. Okay, then compatible blood. So this is the criteria for donor. Second thing, important thing is the blood must be compatible, means if the donor's blood group is O, then recipient blood group must be O positive. This is O positive, then it must be O positive. Compatible, same. Okay, RH positive blood should never be given RH negative individual. Otherwise what happens, delayed type of hypersensitivity reactions, we will discuss in detail, that may occur. Okay, cross matching must be required. What is cross matching? Here if the blood is compatible, then also cross matching is required. Suppose both donor and recipient have O positive blood, but still cross matching. Cross matching means what we do, there are two types of cross matchings, major and minor. What we do in major cross matching, we have to mix donor's cell, donor's RBC with recipient's plasma. Okay, and watch for the reaction. If there is no reaction, then you can say that blood is given. And in minor cross matching, what we do is donor's plasma matched with the recipient's RBC. So these two are required before blood transfusion. Okay, these are the precautions before blood transfusion. Now during blood transfusion, which are the precautions to be taken? One, that is sterile instruments must be used. Second, temperature of the blood must be at the level of body. Okay, because blood is stored at low temperature, so one has to take care that should not be transfused immediately after taking it out from the refrigerator. Okay, then another important precaution, that is transfusion must be slow. Why? Because the stored blood contains citrate, and citrated blood if we are giving, then it results in chelation of the calcium from the recipient's blood. So what happens when the calcium is chelated? Chances of symptoms of tetany may occur because of hypocalcemia. Okay, so these are the precautions to be taken. Now, what are the transfusion reactions? These transfusion reactions are divided in two groups. Number one is reactions because of mismatched blood transfusion. Mismatch means if suppose A blood group individual is given B blood group, that is mismatched. And second that is matched transfusion reaction. If suppose A blood group individual is given A blood group, still also some of the reactions may occur. We will discuss. So first are transfusion reactions because of mismatched blood transfusion. So many times this may be asked as a question. Transfusion reactions due to mismatched blood transfusion. Okay. Now what is the cause of the reaction? What happens as we have discussed? Suppose somebody's blood group is A. RBC of that individual contains A antigen. Okay, so this is suppose this is donor. Okay, and the recipient's blood group is B. So recipient, if recipient's blood group is B, recipient contains anti A according to Landsteiner law, we have already discussed. So what happens, this A and anti A, they get reacted on the RBC of the donor, and that results in agglutination of donor's RBC. And when this agglutinated RBCs, they block the blood vessel. Okay, immediate reaction, that is the person is having violent pain in the back, and the person is having tightness in the chest, so this is the first reaction because of mismatched transfusion. Next one, that is because of this agglutination, second step would be hemolysis. RBCs are destroyed, so hemoglobin comes out, so that results in increase in the hemoglobin concentration in the blood, that is known as hemoglobinemia. And when this hemoglobin concentration increases, that is converted into bilirubin, and this bilirubin is free, and that results in jaundice, and this type of jaundice is known as hemolytic jaundice. Now this hemoglobin enters in the renal circulation because that is free in the blood, so that results in hemoglobinuria. Next reaction. Now another important reaction, or you can say life-threatening reaction or life-threatening consequence, that is renal failure. Kidneys are failed if mismatched transfusion is given. What is the cause of renal failure? And this is the cause of death also because of mismatched blood transfusion. Here what happens, because the hemoglobin causes blockage of the renal tubules, because hemoglobin is there in the circulation, it enters into the renal circulation, it causes blockage of the renal tubule. That is one of the cause for the renal failure. Second is renal vasoconstriction. Why renal vasoconstriction? Because certain toxic substances are release of toxic substances from lysed RBC. When RBCs are destroyed, certain toxic substances are released, and these toxic substances, they cause renal vasoconstriction. Okay, another effect, that is when this RBCs, they are lost and toxic substances are released, because of that there is fall in the blood pressure. So when blood pressure falls, kidneys are not getting proper blood flow, and because of decreased blood flow, there is renal shutdown. Another cause, these are all the different causes. Next is renal tubular damage. What is the cause of renal tubular damage? Because the urine is acidic, and if the urine is acidic and filtration GFR is also less, what happens in this acidic urine? Hemoglobin gets precipitated, and this hemoglobin, as we have discussed, it blocks renal tubules. Okay, so that results in acute renal failure. So which are the commonest causes? That is one, that is renal vasoconstriction, one, okay, hemoglobin that blocks, and third, that is circulatory failure, decreased blood flow, that is known as this circulatory shock. These all are the causes of renal failure, and when kidneys are failed, then that results in oliguria, decreased urine output, and ultimately anuria, absence of urine output. Okay, and then when there is anuria, there is accumulation of nitrogenous waste products, and that results in coma and death of the individual. So this is the reaction because of mismatched transfusion. Now we will discuss about certain reactions because of matched blood transfusion. Okay, they are, one is circulatory overload. What happens when large amount of blood is transfused, that produces circulatory overload, and that is, as we have discussed, hypervolemia, and that is found commonly, and that is life threatening in patients of cardiac disease, as well as and kidney disease, and if the transfusion is rapid, this is more life threatening. Okay, then certain blood-borne infections are also transmitted in spite of matched blood. This is also the hazard of blood transfusion. And which are the blood-borne infection? That is HIV, human immunodeficiency virus, hepatitis B, malaria, syphilis. Okay, so these are the blood-borne infections which are transmitted. Another reaction, that is pyrogenic reaction. Pyrogenic reaction means the person is having fever and chills. What is the cause of this fever and chills? Because of certain antibodies which are produced against WBCs, leukocytes and platelets. And they destroy these WBCs and platelets, and they are responsible for this pyrogenic reaction. Another complication, that is allergic reaction, that is not found in each and everyone. If donor's blood contains some substance to which the recipient is allergic, then only this reaction is found, and it produces skin rashes and asthma. Next complication, that is hyperkalaemia. Potassium level increases, and this is found after excessive transfusion. Why potassium level increases? Because stored blood has high potassium. Why high potassium? As we have discussed, in stored blood, you can see here, suppose the blood is stored, this RBCs, normally all the cells, they have sodium potassium pump. What is the role of sodium potassium pump? It causes 3 sodium to pump outside and 2 potassium to pump inside. Okay, and this is failed here. So what happens, that sodium ions are not pumped outside and potassium ions are not pumped inside. So outside potassium concentration is more, so there is high potassium level in the stored blood. Then hypocalcemia, this is also found after massive transfusion. What is the reason of hypocalcemia? Because of the citrated blood, because citrate chelates calcium ion. Okay, and because of hypocalcemia, signs of the tetany may develop. Okay, now next small topic, that is autologous blood transfusion. What is autologous transfusion? That is transfusion of blood from the same individual. Suppose any planned surgery is there, elective surgery is there. In that case, blood is stored, and the same blood is given to the same person who is undergoing the surgery. So during planned surgery or elective surgery also, this autologous transfusion is advantageous. And sometimes during surgery also, we can use cell saver machine. This cell saver machine, what can they do? They suck blood from the wound and recycle it, and the same blood is to be given to the individual. What are the advantages of autologous transfusion? All the advantages: the person will not be having allergic reaction, person will not be having transfusion of blood-borne disease. Okay, so these are the advantages. Now storage of blood, that is another small topic we are going to discuss along with this. Storage means blood is stored in the blood bank, in this kind of blood bags. Now what is the composition of the, or what are the constituents there in the blood bag? Sorry, 1 unit of blood, that is 420 ml, that is mixed with the ACD mixture, acid citrate, okay, and dextrose. So acid citrate dextrose mixture, it contains citric acid, trisodium citrate, dextrose, and distilled water. Okay, now what are the use of all these constituents? Dextrose, that provides energy, as we have discussed, for sodium potassium pump. Glucose is required for the Krebs cycle to produce ATP, and that is required for the sodium potassium pump. Citrate is having anticoagulant property, coagulant, and this blood can be stored for 21 days, and it can be stored at 4 degrees Celsius for 35 days. Okay. Now what is the effect of storage of blood on different cells? So if we are talking about RBC, what is the effect of RBC when we are storing the blood? RBCs, they get swollen. Why swollen? Because decrease in the ATP and 2,3-DPG, and that is required for the activity of sodium potassium pump. Okay. Also there is increased intracellular sodium. As I told you, sodium potassium pump, when not acting, what happens? Sodium, this is normal sodium potassium pump, but when it is not acting, inside sodium increases, and as sodium increases, water also increases. Okay, then when RBCs is swollen, and they can be easily hemolyzed in the hypotonic solution, so they become spherical, so easily they can rupture when they are placed in the hypotonic solution. Okay, and stored blood after transfusion, it becomes normal for the reference of sodium potassium in less than 48 hours. Then what about the WBCs and platelets? WBCs and platelets are absent after about 24 hours. So you cannot transfuse WBCs and platelets in the stored blood. We require fresh blood to transfuse or transfer platelets and WBCs. And platelets also, they become non-functional within 4 to 6 hours. Okay, sorry, 36 to 48 hours. Okay, now, so after transfusion of stored blood, we cannot provide the actions of WBCs and platelets. Okay, 80% of the RBCs, they survive for 24 hours, and then after surviving cells, they are destroyed at a rate of 1% per day. So RBCs are also destroyed gradually after the transfusion of the blood. Okay, so this is all about blood transfusion and blood storage and some important aspects related to it. Okay, again I would like to inform you that you will get all my lecture notes by downloading my application Vesalius, that is available on the Play Store, and you can get the subscription, so you can get all my lecture notes in soft copy. For hard copy, you can order my book, that is Physiology Notes, which is available on Flipkart and Amazon. Link for all that is given in the description box. Okay, thank you so much for watching me. If you like my video, you can like it, you can share with all your friends and subscribe my channel. Thank you.